All right, we'll go ahead and get started. Welcome everyone who is here so far. I cannot see any of you and I don't know who any of you are, but welcome. My name is Ashley Coleman. I am part of our clinical training team here at Bierman, and I currently help out with a lot of clinical projects, but I also oversee all of our new hire training across the company and across all of our different locations. Just a little bit more about me. I have been with Bierman for 10 years now. I have been in pretty much every clinical role that we have across different locations. I am located in Indiana. So if any of you are from Indiana, I have been in Westfield, Broad Ripple, and Avon over the last 10 years. I currently work remotely. I live up north in Sheridan, Indiana. I'm currently a BC ABA, and I'm back in school again to complete my master's for my BCBA. If you guys want to, and if you know how to use the chat on here, if you want to just type in there where you guys are located or where your child receives services, or if they don't, where you are from. I'm just kind of curious where everyone is at. If you don't mind typing in the chat, if not, that's okay too.
Got Canada, New Jersey.
Oh, wow. Quebec, awesome. That is one of the places I have never been. So one of these days I would love to travel up to Canada. I've also never been to New Jersey or Boston. I've been to Avon, so whoever is out there in Avon, I've been there. Awesome. Thank you guys for sharing that. All right, we'll go ahead and move on. So we want this presentation to be as interactive as possible. If you have any questions or you'd like to add anything throughout the presentation, please type in the chat. Courtney's here with me and she's going to help monitor that for me. So if you guys do have any questions, or if you want to add any experiences that you've had, anything like that, please feel free to type in there, and I would be happy to share that, but also answer questions if I'm able to. So some of our objectives, or what we're going to cover today, are first providing a quick overview of applied behavior analysis. We won't go too in depth into that, as we cover that a little bit more in depth in another training that we have provided and that we will continue to provide throughout the different months in our trainings. We will also go over an overview of speech therapy. I'll provide an overview of occupational therapy, and then at the end, we'll discuss the collaboration that we practice among all different providers within Bierman. So first, let's talk about applied behavior analysis, or ABA. So what is ABA? Like I said, this is going to be really brief. We could talk about what ABA is for the entire hour, but we'll go over this briefly and then talk about speech therapy and occupational therapy as well. So ABA is a science dedicated to understanding how and why humans behave. So behavior is anything that a living organism does. This can range from you, me, your children, your friends. It also relates to your boss or the dog down the street. When we talk about applied behavior analysis, though, we're talking about the standpoint of making socially significant changes in human behavior. And the only way that we can do that is to learn how and why someone behaves the way that they do. And then we work with the environment to improve it in a socially significant way. So just to be clear, when we talk about social significance, we mean teaching skills that will improve the overall life experience for someone. An example might be following safety commands, following directions in the community so that a child or an individual can go and enjoy more community experiences. It may also be teaching how to ask for things that they want or things that they need so that they can have better relationships with those around them. So that's a little bit more quickly about ABA. ABA can be used to target several different areas when we talk about teaching new skills or working on target behaviors. So these are some of the basic areas that can be targeted within ABA therapy, but the list goes way beyond these areas. But here's a little bit about some of the main focuses that we target. For communication, that could be communicating vocally, using gestures. We could be communicating or teaching a child to communicate using a device. It could be sign language, pictures, any of those modalities that fit under communication is usually our biggest focus in ABA. And then we talk about and targeting social behavior, and that could be working on greetings, working on eye contact, responding to peers, requesting to peers, all of those socially significant behaviors. And then we also target and focus on toilet training if that's appropriate for the learner. We also work on prerequisites to toilet training. So, toilet training is this big umbrella, and then there's all these little skills underneath of it. But if a child cannot, pull their own pants down, we're really not helping them with their toileting, because ultimately we want them to be independent in that task. So we might work on some of those prerequisites first, like dressing, hand washing, being able to sit for longer periods of time, making sure the bathroom is not aversive, things like that. And then we also focus on play behavior. That might look like working on functional play skills. So the things that the kids are playing with, but also that they're playing with them functionally. Independent play. So once we get that functional play, how can we increase the time that they're able to play on their own without someone directly with them or guiding them? And then we also, under that umbrella, might focus on pretend play. So teaching pretend play in different with different items and activities and things like that. And then we also look at independence as its own little area that we target as well. That might be independence within tasks like hand washing, routines. So like morning routines, bedtime routines, like getting set up like at the center in the morning, maybe putting their backpack away, hanging up their coat, putting shoes away, things like that. Or eating routines. So being able to clean up their dishes and throw away their trash, things like that. And then the last one on here is tolerating non-preferred tasks. So this would obviously vary by child depending on what they're able to tolerate and what they may struggle to tolerate, but it could be things like tolerating cleaning up, tolerating transitions. So transitions maybe away from preferred things across locations. And a big one, but this is for typically developing children as well, is waiting. Waiting can be very difficult. All right, so now let's go into discussing speech therapy services and a little bit more about what speech therapy is. So this speech therapy is the assessment and treatment of communication, language, and speech disorders. And then these are some of the things that they focus on. So speech disorders, language disorders, pragmatics or social skills, augmentative and alternative communication, or you might also hear of that as AAC, and then feeding and swallowing disorders. And I'll give a little bit more information on what each of those are. So for speech disorders, this would be looking at how we say words or how we say sounds and the intelligibility. So are people able to understand us? And then we look at language disorders. So what is language? When we hear that, they're referring to the words that we use and how we use them to share ideas and get what we want. So that might look at grammar and sentence structure and things like that. And then pragmatic social language, what is that? So that is how we should use our language at certain times or in specific situations. So we change our language based on the situation or the person. So there's different purposes that we use our language for. Are we greeting others? Are we requesting for things? It also looks at like conversational rules. So how do we use eye contact within conversations, taking turns, back and forth within conversations? And then it also looks at how to use and interpret nonverbal language. So that pragmatic social language is a big component here. And then AAC. AAC is different ways to communicate to supplement or compensate for spoken language. So this, in most cases that you'll see, will be sign language or some type of speech generated device. I know since I have been in the field for the last 10 years, the speech generated devices have just really taken off as far as accessibility and options and the different what they can offer for not just children with autism, but children with different disabilities. It's been really cool to kind of see that evolve. All right. Here we go. Okay, so as far as we talked a little bit about what some of the focuses are for ABA, so communication and social skills, independence, things like that. So I wanted to talk a little bit about what the focus is for speech and language pathologists, or when we talk about speech therapy in pediatrics, so with this younger population. So they focus on, like we said earlier, some social language and that pragmatic part of social language. And again, that's where they focus on greetings, commenting on things within their environment, eye contact, and body language. And they also focus on receptive language. So are the kids able to follow directions, identify objects or people or places? So if they say, go give this to your mom, can they follow that direction and identify mom in the environment? And then also understanding WH questions. So what, where, why, when, those types of questions. And then the last one is expressive language. And within expressive language, they focus on articulation, vocabulary, grammar, and sentence structure. Again, this is not an exhaustive list, but just a general overview of some of the main focuses within speech therapy.
We got a question.
Yes.
Would Gestalt language processors fall under language disorders?
Say that one more time.
Would Gestalt, I hope I'm saying this correctly, language processors fall under language disorders?
You know, I don't know the answer to that. I work with a lot of speech language pathologists, but I am not a speech language pathologist myself, and I do not provide speech therapy. That's a great question. If you want, Jennifer, if you want to private message me or Courtney your email, I can find out with our SLPs that we work with in the company, and I could get back to you if you'd like. So sorry, I don't know the answer to that question. Any other questions, Courtney?
Nope, that was it. Someone left, but they asked if this will be available, and it will be available on the website if anyone wants to share with anyone later tomorrow afternoon.
Awesome, thank you. All right, so as you probably have already seen, talking about ABA and some of the focuses that we target teaching in ABA, and then also looking at the focus for speech therapy, a lot of the things that we're teaching overlap. So you'll see that within speech language pathologists and with BCBAs or board certified behavior analysts, there's a lot of common goals. So some of those may be vocal imitation, requesting, using AAC, language acquisition, following directions, and feeding. And that's why we work so collaboratively with SLPs and overlap speech sessions and things like that, because a lot of what we're targeting and teaching with our clients actually overlap quite a bit. All right, now we talked about ABA, we talked about speech therapy, so let's talk about occupational therapy services. So first, let's just tackle what is occupational therapy. So This is how it's defined by our OTs. So an occupation is any activity that occupies your time. So that might be leisure activities, it might be more job related, play related, anything of that sort. And then as far as application goes, when a diagnosis or an injury prevents you from meaningfully engaging with your daily occupations, that's when you may seek out these types of services. And again, this isn't just applicable for kids with autism, it's applicable for typically developing children, adults or children with different diagnoses. So it's much broader than just kids with autism. And then we'll look at the focus for OT or occupational therapy within pediatrics. So they focus, one of their focuses is on play. And a lot of things that you'll see within OT sessions will involve puzzles, cause and effect toys, ball play, climbing, swinging, interactive games. Within all these different play activities, we can incorporate a lot of different skill acquisition targets, and it's embedded within play. So what's great is our kids don't even know necessarily that they're learning or we're teaching them. It's embedded naturally, which is always our biggest goal when working with young children. And then as far as eating goes, OTs work on use of utensils, and they also can work on like oral motor skills or oral motor control, and also work on tolerating different food consistencies or textures. I'm not sure if this is applicable for any of you and your kids, but this is common not only for children with autism, but I think even typically developing children. Sometimes we need some help in that eating area. And then another area is education. So OTs can work heavily on more academic skills, such as handwriting, drawing, using scissors properly, gluing paper, gluing different arts and crafts activities and things like that. And the last one is related to hygiene. So they can work on bathing, brushing teeth, dressing, any of those more independent living skills. And then they also focus on fine motor, gross motor, and visual motor skills. Those are pretty broad as far as that skill goes, but most of what they do incorporates one of these three things, if not all.
We got another question.
Yeah.
With staff and SLPs wearing masks all the time, do you see this as a barrier to providing the best speech therapy for our kiddos?
Yeah, I know there's a lot of different masks and shields that the team can wear so that clients are still able to see the mouth and more of the faces. So I think that originally probably because I do think that it's valuable for kids to be able to see our mouths and our faces and our expressions and things like that. But I do know they've come quite a far way with options with shields where you can still see the whole face, or different masks that you can still see, like clear masks, things like that. I don't know about you guys, but I am ready for all of this COVID stuff and the pandemic to move right along so we can get past having to worry about wearing masks and how that can affect children in general, but not just our kids with autism. Okay, so we talked about common goals for speech and or for speech language pathologists and then BCBAs when it comes to the client's programming. So now we'll talk about common goals that both an OT and a BCBA may target with a client or with a learner. So again, gross motor and fine motor imitation are really common goals when it comes to OT and then an individual client programming by the BCBA. Play skills is a common goal that overlaps from an OT and a BCBA as well. Feeding, and then daily living skills. So, and just to give a little bit of an example. So if we talk about daily living skills as this common goal between an OT and a BCBA, what they target daily living skills as a whole, but what they target individually might look a little bit different. So an OT would focus on the actual skills. So whether that was dressing or brushing teeth or something like that, eating, utensil use. And then the BCBA is going to be the one that's going to program for tolerating, working on those skills or tolerating interfering behaviors during those tasks. So for example, if the client has a really hard time attending for a long period of time, or they have trouble sitting in a chair, which makes it difficult for them to eat a meal at a table, those would be the goals that a BCBA would put into place, whereas the OT would be the one working on the actual skills, maybe using a utensil or sitting in the correct position or something like that. All right. So now we'll talk a little bit about collaboration with speech and OT and what that looks like. So what can OT and SLP services look like? There are two different services or types of models that we use. So ABA is typically a 40-hour-a-week program that is overseen by a BCBA, and then OT and speech are incorporated into this time each week. So we'll look at direct services first. When an OT or an SLP provides direct services, that includes a standardized assessment. They develop goals in collaboration with parents. And then they provide one-to-one services with an OT, or the client receives one-to-one services with an OT or SLP based on clinical recommendation. And then on the right side, we have our consult model. And what that looks like is the OT or the SLP and then the behavior analyst meet to discuss common goals. And then the OT or the SLP will overlap within the ABA sessions to problem solve and support therapy throughout the week. So that's kind of what a couple different options might look like.
Ashley, we got a question asking if our facilities are providing group speech sessions in New Jersey. And she mentioned that a lot of them are starting up again.
I don't know the answer to that. I am not very involved in the New Jersey location other than new hire training. And I also don't know much about the group speech sessions, but again, I can find out that information and get you an answer. All right. So just looking a little bit more at what collaboration can look like, I kind of broke down some different goals and then talked about, okay, how will the OT or the SLP target this skill? And then how will the BCBA target this skill? And then how they kind of work together. So if we're working on fine motor imitation, so working on some of those really hard fine motor skills, maybe we want them to do some thumbs up or do pointing, anything like that can help with fine motor strengthening, things like that. The OT may focus on assisting in identifying the most appropriate targets based on development, and then also maybe help with correct hand positioning. And then the BCBA will then identify how to teach those skills or those targets. Maybe they'll identify the best way to prompt the child or the best prompts to use. And then the BCBA will also be the one who is training the team. And then the second example here looks at vocal imitation. So, and this is going to be between an SLP and a BCBA. So if we're working on vocal imitation, so we're trying to get more control over a child's vocal. So having them repeat us. So say, I want the cookie, or say, run with me, whatever it might be. we're trying to expand their language, the SLP is going to assist in identifying what is developmentally appropriate. So when we're teaching communication and requesting skills, we want to make sure that what we're teaching is developmentally appropriate. We shouldn't be teaching a 2-year-old to say something that maybe isn't developmentally appropriate until they're 4. So that's where the SLPs really assist in making sure that the targets that we're teaching and the skills that we're focusing on, specifically around communication and vocally imitating different sounds and words, is developmentally appropriate. And then around that same goal, the BCBA would then identify how to teach those targeted behaviors and then train the team. So that's kind of the difference on, how we would collaborate, but how their goals and their part in the collaboration may look a little bit different. And then we'll look at a couple more examples. So let's say a feeding goal. We've got a feeding goal in place for one of our clients, and this may involve the OT, the SLP, and the BCBA. So I thought it would be cool to kind of look at one goal and how each one of those people are involved in the client's progress and surrounding that goal. So if we're looking at feeding, an OT may assist in identifying appropriate seating position and gripping of utensils. Okay, so they're going to make sure that the child is in an appropriate chair, and that their feet are on the floor and all that fun stuff. And then making sure that what is appropriate or how it's appropriate for them to grip the utensil. And then the SLP may assist with chewing or helping strengthen their oral motor skills. And then the BCBA may assist with tolerating foods and sitting at the table. So that is just one goal that shows how each one of these individuals is involved in that goal with the learner. And then the last one example I wanted to go over was an AAC goal. And this would be more collaboration between the BCBA and the SLP. So there would be collaboration on use of the device throughout the day within ABA sessions. That would involve the BCBA, the RBTs, and the SLP. But the SLP would also be the one that assists in determining the appropriate device and help with insurance coverage. So like I mentioned, over the last several years, the options for AAC and then also different devices has grown, exponentially that I can remember since I've been with the company. So it's not just a couple of options. There are several options. And that's where the SLP comes in with their knowledge and education on what the appropriate device would be based on the learner, and then also can help out families with insurance coverage. The goal is always to collaborate as much as possible so that we can promote the most success for our learners. All right, so just some, key things to wrap us up. I guess I realized this went a little bit faster than I thought, but at the end we can chat through if you guys have any questions or if different experiences that you want to share. But if you are a Bierman client, you would be eligible for these services as far as speech therapy and occupational therapy go. And then BCBAs and SLPs and OTs work together to ensure the most progress is made. So we're not just looking at making progress, but how can we all work collaboratively to ensure that the time that we have with our learners, that we're making the most progress that we can, because we know time is valuable. And obviously we are all here because we know early intervention is key as well. So like I said, it went a little bit quicker than I thought, but does anyone have anything that they would like to share? Does anyone have any other questions for me? Like I've said a couple of times, I don't know all the answers related to speech and OT, but we've got a really great team here at Bierman across all of our centers that I can find the answers and get those back to you if I need to.
Okay, I see someone raise their hand. If you want to just add your question in the chat, we can definitely answer it that way.
Thanks, Courtney. I cannot see everything. I'm not an expert on these like you are.
So far, we don't have any questions.
Okay.
Oh, here we go. Do you have schools in Massachusetts for 4-year-old?
Yeah, as far as our ABA centers go, we have several 4-year-olds across a lot of our locations. In Massachusetts, we're located in Bedford, Needham, and Randolph. If I think those are the names of the towns. I don't live in Massachusetts, but I know those are the names of our 3 centers. So I'm assuming those are cities in Massachusetts. And yes, we would be happy to take a 4-year-old, of course, after doing some intake and assessments and all that fun stuff. Any other questions? Yeah, Jennifer, is your do you have a child that's currently in the Berkeley Heights location? Yeah, if your child is at the oh, I do not. We're looking to sign or sign up for a pragmatic group. Gotcha. Yeah, Jennifer, if you need any information, it can be found on our website, but I'm also happy if you want to shoot Courtney or I your email. We can also connect you with someone in that location as well. Yeah, we have one center in New Jersey. It's in Berkeley Heights. I don't know where that is, but I do know we are in New Jersey. Correct me if I'm wrong, right, Courtney? That's in New Jersey?
Yes. Yep. Berkeley Heights.
Yep. Thank you. I've always been in Indiana since I've been with Bierman. So I have not traveled to any of our other out-of-state locations before. Well, if you guys don't have any other questions, you're welcome to go ahead and log off, but I can stay on just for a few more minutes in case anyone has any additional questions. And I hope you all have a great night, and thank you so much for joining us. Courtney, when's the next webinar? I believe it's going to be in April.
I can check that right now.
So Anne Marie, we typically do monthly webinars, so we can get you that information so you can join us again in April. Thanks for joining, Laura.
Yes, April 12th is the next one.
April 12th, thank you.
Sorry, that took me a second. I think Anne Marie, you might be referring to CEUs, maybe. And these are caregiver webinars, so these are just free courses to help you, understand certain concepts. But CEUs are available, and at the end of those, there'll be a quiz, and you pass it, and then we send you the CEU certificate.
Yeah, so this specific webinar was not for CEUs. It was more for for parents and guardians and caregivers and things like that. So this one was not a CEU, but like Courtney said, we do offer other trainings that are eligible for CEUs. No problem. Is it just us left, Courtney? I can't tell.
It looks like Kimberly's still on. Kimberly, do you have any questions? It does not appear so. So I think we are good.
All right. Then. Perfect. Well, thanks for all your help, Courtney.
Thank you.
Yeah,
Bye.
have a good bye.